One of the chapters we most likely gonna skip is the nutrition, guys, because if I go over it, it will take from what systems. So metabolism and nutrition, most likely I would say depends on the time. I'm gonna skip that chapter and focus on digestive, acid-base balance, reproductive, because time is running fast. We have to finish those chapters.
Yes.
Yeah, we know nutrition is important, guys, but because of A and P, I'm just gonna focus on systems here. All right?
Yes.
Meanwhile, I will keep it, save it for yourself, read the slides, if you wanna educate yourself more. Today, hopefully we can finish most of this one. If we have extra days, I can do open labs for you. Yeah, so we can take from lecture time when you come in, you just review before final. So I may have the whole day as open lab before the final. Final would be, it falls on Tuesday or Thursday, I think Tuesday, after the week.
I thought the lecture one was on Thursday.
I thought it was
The
Lab
lecture
correct?
is on Tuesday and the lab is on Thursday.
What?
No, the opposite.
Okay. Oh.
I think the opposite, because you have the weekend to study for the lab, okay? And if I do it on Thursday, you're gonna forget some of those that you
Yes.
studied for the, I wanna make it just
Yeah.
immediate.
Tuesday is the lab.
Yeah, because Thursday, the week before, you're gonna have complete review, so better to come in on Tuesday. I don't wanna have a week separate, so you may forget, a lot of things. So we're gonna have the lab on Tuesday and the lecture on Thursday, okay? And open lab, if I can do the whole week for you, the week before, I can do that, okay? Here is the digestive system. So we're gonna do anatomy, physiology. I just want you to look at this, compare it also to the torso model that we have. Should be the same, but when it comes to the liver, we're gonna go into more details. When it comes to the stomach, it's listed in, because on Thursday, we're gonna have a quiz. Don't forget, we're gonna have a quiz on Thursday, which has 3 diagrams, and most of those will be also coming to you on models. Yeah, compare what you studied and hold the model in your hand and know those structures, because I'm not gonna bring you diagrams anymore. We have to know them on models and surface anatomy that you see it here. Yeah.
So the quiz on Thursday is for the lab, the 3?
Yes, the 3 diagrams, exactly.
Okay.
So there's one respiratory, there is one for the stomach, I believe,
for this.
and the liver and pancreas together.
And you said you're
With
gonna
all-
use models or diagrams for this Thursday's quiz?
No, this
Diagrams?
diagrams,
Yeah.
final lab models, final lab, purely models, except, I said except.
The
What-
liver?
No, no, liver, we have it, we have the liver here,
Oh.
except the blood, if I need blood cells that
Oh,
hard
okay.
to see them on a
Slide.
slide, so I can bring you diagrams for that. Yeah, anything that I feel like it's hard to locate, I can bring you diagrams. And it's directly from PowerPoints, your book. Yeah, what's your question?
Say, is there
Yeah.
maybe a cleaner picture than this?
Difficult
Refreshing.
to-
It's to read, it's
Yeah, it's in
refreshing it.
It's in your Pearson.
Okay, it's in the.
Do you have Pearson?
Is
Maybe
that-
because we took a photo and then uploaded.
Is this from the study guide?
This is the
Yeah,
last
that's from
page.
the study
Yeah.
guide last page.
So is this gonna be on the, we're not?
Yeah, that's gonna come in,
That's
you're
on
gonna
Thursday.
fill those, but if you want better picture, it's the same, but better view, just go to your Pearson. You're gonna find, I forgot the page.
Okay.
If you can pull the page from
No,
Pearson.
Figure 36.1.
Oh, here, yeah,
Yeah.
figure 36.1.
Wait.
If the picture is not clear, go to figures 36.1.
So there's
Okay.
that one and then that one?
And the last 3.
System
The last three would be, and I'll try to get you a color. Yeah. I'll talk to the guy here and ask him if we can get them in color. That would be perfect. Okay, so here is again. This is in cadaver. We don't have cadaver,
Bummer.
unfortunately. In Southwestern, we had 2 cadavers, volunteered by 2 elderly. And the problem here, if you're pregnant, we always ask you to drop the class if we have cadaver, because the room is filled with formalin. And formalin can proven to have what? Fetal abnormalities, congenital, yeah. So if you're exposed to that formalin, there is a risk. So every time I lecture at Southwestern, I have to tell the students, if you are pregnant, I'm telling you, drop the course, because it's not my responsibility.
How are you gonna pass the test? I mean, that certain class if you're pregnant.
You can, for example, take it in other schools that they don't have it. The problem is also they dissected the cats. Here we're doing fetal pigs, so it's different. The good news here that our dissection organs, they're kind of like preserved with secret Carolina solutions, so they don't have formalin. That's why I didn't say anything at the beginning. I didn't say if you're pregnant, drop the course. But over there is formalin, and there is a room with cadaver and covered with sheets that's soaked with what? With formalin. And you smell, the moment you open, you smell all the formalin. So for that reason, it's risky to continue that class. But I assure you here we have the Carolina solution. They call it secret. They don't want to reveal it maybe for business thing. Anyway, but here is the cadaver. Okay, the moment you open the abdomen of a cadaver, you're going to see that fat, kind of like it looks fat with a layer on it. This we call it the greater omentum, the one I'm pointing to. You see that color? That's greater omentum. That's a fold of peritoneum. I'm going to talk about it. But you also see the intestinal loop, the small intestine. You can see it here. Large intestine. You can see all the large intestine. You see that one? That's the transverse colon, descending, ascending, cecum. You know, but here is the small. Look how long is the small intestine. They estimate 20 feet. That's a lot.
That's crazy.
That's crazy when you think about it. But 5 for what large? So 25 coiled here. Imagine. You won't believe it. You say, is 25 feet coiled here? That's amazing when you think about it. But it's connected. It's not going to be separate. Why? Because when we dissect the fetal pig, which coming soon, of course, you separate the intestine from each other like this. You see a membrane in between them. That's we call it mesentery, and it is a fold of peritoneum. And when you separate the colon, you're going to see a membrane also that hold it. This is we call it mesocolon, which is a fold of what? Peritoneum. You see, peritoneum makes folds here. It's not just you think about membrane that cover the abdomen. No, it makes folds, and those folds, we're going to talk about them today, the folds of peritoneum, because it's digestive system. Okay, so I mentioned some for you. I'm going to add more when it comes. At least you know now how many. I would say 3, which I mentioned: the greater omentum, mesocolon, mesentery. But I'm going to add more, because we have lesser omentum. I said greater, we should have lesser also, lesser omentum. But wait until we get to that. Okay, here is the liver. You can see the liver. Now, if I ask you main organ of digestive system, it starts from the mouth here, going pharynx, esophagus, just go straight all the way. Follow the bolus of food that you swallow. That's we call it what? Main organs, okay? All the way, stomach, intestine, small, large, okay, all the way, rectum, anal canal, anus. So those we call them what? Main organs of what? Digestion. Now we have accessory organs, and I'm gonna point to them. Your teeth. Yeah, they're sitting in the mouth. That's accessory. We have also salivary glands that you see them in what? Yellow color. See it? Salivary glands. We have the carotid. It's just behind the lobe of your ear. Yeah. If you remember the mastoid process that you took in part 1, yeah, it's just covering that area. We're gonna see it on fetal pig. That's a good thing. We're gonna see those salivary glands when we start dissecting the head. We have here the teeth and another accessory. We said the salivary glands. We have the sublingual. You can see it here. Submandibular, parotid. All right, and all of those are pairs. So how many we have total in your body? Six.
Six of them.
Okay. How many tonsils we have? 5.
Five
See the
tonsils.
difference here. Okay.
So-
And then, yes,
They got 5 tonsils, right?
yeah, because you have one adenoid, that's why.
So when they remove tonsils, is it, they're removing all 5 or is it 2?
No, they remove palatine
Okay.
and they remove what? Adenoids. So they remove 3.
3 of them, okay.
3?
So you got the 2 and then the adenoids.
Yeah,
So
we leave the one which is behind the tongue here. We call them lingual, we don't touch those.
Okay.
Okay? And that's why they call it adenoidectomy and tonsillectomy. It's combined operation. So we remove the 3 in this case. Now, that's we said the main, and now the accessory, we learned it here in the mouth, oral cavity. Then, what's that? Liver. Liver is a digestive organ, and liver is an immune organ. And why? If you remember, I said there are phagocytic cells called Kupffer cells in your liver. So that's part of your immunity. And also, if you remember, when I said you can live without a spleen, so liver can take over and share the function of the spleen, which is what? Taking care of what?
The waste.
Ward out red blood cells, exactly. That's why they ask you, is it, what do you classify the liver? I would say it's not just digestive, it's also part of immune system, okay? Now we have this as an accessory because of how the liver help us in digestion, guys?
What, the gallbladder, or what are you talking about?
No, liver,
Oh, liver.
you're close, you link it to something.
Enzymes?
Not enzymes actually are from the pancreas. You said it, gallbladder. What is stores, guys? Bile. Okay, so
Oh, yeah.
bile made by liver cells, drained all the way through the ducts, storage in that gallbladder,
It releases.
releases it when you
Eat fat.
fat, exactly, or lipid. So when you take any meat that contains fat or lipid or fatty acids, you rely on what?
Your gallbladder.
On the gallbladder. We need it. And if you have indigestion when you eat fatty meat, I'm gonna put question mark on the gallbladder.
Why?
That means you may have less bile form. You may have obstruction with a stone, okay, which can be familiar. Okay, we're gonna talk about it. I'm gonna show you all the ducts. And okay, one of my favorite is knowing those ducts on the liver. Liver model is sitting there. Take a picture of it and remind me also before leaving to open all the keys for you. Yeah, make it easier for you because I know students, you know, by the end of this course, they can be nervous. It goes back and forth. What we need to study from this? What we need to study from this? So I will project them for you.
Okay.
One after one, take pictures, and then study them at home. Okay, so that's one of the accessory, and we know why it's accessory, because again, hepatocytes, which are liver cells, they're making the bile. Okay, the bile drained all the way through the ducts, stored here in the gallbladder that you see it in green color. And the reason it's green because what's inside it has a thin wall, by reflecting what's inside it, which is bile. And the bile is green because of bilirubin. Yeah, it starts as biliverdin, then bilirubin. Yeah, kind of like start to be yellowish green after that. But verde is what? In Spanish, I think. Green, correct? So biliverdin, then bilirubin, step by step. And bilirubin tend to have what? The yellowish coloration. Yeah. That's why we like to break it down after that, otherwise your skin gonna show as yellow color. But your body has enzymes in your intestine breaking it down, and that's why you're not gonna see it in your urine, you're not gonna see bilirubin in the stool, because it changed into stercobilin and urobilin. Yeah. It gives the color of the stool, which is brown, and it gives the yellowish coloration of the what? Urine, which is urobilin. But no bilirubin in the stool, no bilirubin in the urine. If I see bilirubin in the urine, that means you have jaundice. There's something wrong is going on here. Okay. Now, what else we have as accessory? And it's in front of you guys. Pancreas. You can see it here. See it? That's the pancreas. And this one is, I would say, the main enzymes released from it, guys. We have amylases, we have proteases, and we have lipases, carb, protein, and lipid. And even you have nucleases in the pancreas, pancreatic enzymes. And all of them released from where? Because you saw a slide, and if I ask you, remember when you saw that pancreas slide, where those are released from? Because we said you're making about what we said, a liter every day. That's a lot. That can fill a liter of bottle. Because look how much we need those enzymes every day. So who remember from where those enzymes release? Go back to the slide that you saw.
The islets?
Which one? The eyelids?
Yeah.
No, it has nothing to do with that. Those are alpha cells.
Oh, yeah,
beta
the
cells.
acinine,
The acidize. Pancreatic
the
acid.
CD.
Yeah. So the pancreatic acinine, those are the ones that release all those enzymes. And you saw them in the slide. Make sure to know the slide as well. Okay, so now we know the accessory and main organs. So we're done with that. This is just, yeah, that's what we talked about, the accessory. See, did we miss anything? The tongue? We missed the tongue, of course. Why the tongue is accessory? You may tell me, I can just drink. Tongue has nothing to do. But it's a blender. Yeah. When you have a bolus in your mouth, and that tongue is moving back and forth. It's a muscle, it's a skeletal muscle, so it acts as a blender. So we can't ignore the tongue, so add it also to the list. Teeth, salivary glands, we talked about them, liver, gallbladder, and pancreas. So all of those are accessory. Okay. We have processes that you start with. You put the food in your mouth, that's ingestion. Okay, that's the first one. Then we need secretions. We need mucus, we need buffers, especially your pancreas act as a buffer because acidic chyme, we call it, or chyme, whatever you wanna pronounce it. That's gonna leave the stomach full of acid, because your stomach is producing HCl. Okay, so the duodenum, which is the first part, is not equipped with mucus to protect it like the stomach. So if that acidic chyme is not neutralized, it's gonna be disaster on your what? Duodenum. You're gonna have duodenal ulcer. But the good thing, we got help from the pancreas that immediately released to the duodenum alkaline secretions. And it can reach 8.5, which is good for pH. That's above the 7. That's neutralized immediately, the acidic chyme that left the stomach. Okay? To avoid any duodenal ulcer. That's the purpose of your pancreas. And that's why one of the first signs of pancreatitis, just to let you know, sometimes can be alcoholism. And they come in having that pain. So if we find the pancreas is inflamed because of alcoholism, which is the #1 cause of pancreatitis in the United States, those actually patients, they can come with signs of duodenal ulcer. Because when the pancreas is inflamed, how are we going to neutralize the acidic chyme? It won't be able to do that. So sometimes they present with duodenal ulcer. I'm not talking about gastric ulcer. Gastric is for the stomach. Okay, so now you understand the importance of those enzymes that are released. And we have enzymes, we're going to talk about all of them, starting from the mouth, all the way down to the intestine. Even your intestine has enzymes. Mixing and propulsion, we know this is the peristaltic movement. Digestion, mechanical and chemical, or both combined. For example, if I ask you the tongue, do you consider it mechanical or chemical?
The tongue is mechanical and chemical.
Both.
Yeah.
Both. Why? You
Because
want to
it
understand?
breaks down,
No, breaks down.
breaks down
That's
mechanically, and
mechanically.
then also with chemical as it goes down.
What's the chemical? That's the question. Very good.
What is it, Harlan?
Salivary glands.
How is that part of the tongue?
No, not salivary. Yeah. Lingual lipase.
Oh,
Yeah.
okay.
I'm not talking about the salivary glands. I'm
No.
talking about the tongue. So write it down, lingual lipase.
The tongue
Yeah,
itself
it's
releases.
amazing when you think about the tongue produce
Yeah.
also enzyme.
That's insane.
That's why I put chemical, because I want you to understand where this came. So lingual means tongue,
Yeah.
lipase work on the lipid. But don't think that the tongue digesting your lipid
No.
in the mouth. It never, it's kind of like a warming up process, you see? So it's a warming up process that can actually break down the triglycerides, that's a complex, correct? Into diet only. But that's not digestion, triglycerides. Okay? Like a 3 into 2, that's it. But it's not complete digestion. That's not considered. But we have to give credit to that. It's a warming up process. So lingual lipase. We have some which are purely chemical, like you guys know salivary glands is a good example. It has nothing to do with the mechanical here. They just release those salivary amylase. So remember, we have another one now we learn. Salivary amylase. Do you think we're gonna break or other name, guys, you may see it under tiling. It's the same. So don't be confused when you say, when you see or read about the tiling. It's the same, salivary amylase or tiling. The P is silent. You don't pronounce the P. Okay. So is this gonna completely digest the sugar, the carb? No. So what it does is the same as this, but we're gonna change the name, polysaccharide. Into what? Digestive. Exactly. All right? Warming up process in the mouth. That's what you need to know. Then we're gonna continue down. Pharynx doesn't have enzymes, so purely mechanical. Esophagus doesn't have enzymes, just, peristaltic movement, both pharynx and esophagus, and pushed it down to the intestine. And in the intestine now we have number 5 here, which is absorption. In the small intestine, the nutrients will be absorbed. How about large intestine? Just water. And that's why the waste will be solidified when it reaches your what? Large intestine. Notice in the small intestine it's still mushy. Yeah, it's still soft. But when it reaches your large intestine, because it sucks more water from it, not the nutrients, it becomes what? Solidified. So that's the difference here. Now, why the intestine is assigned for absorption of nutrients, but not the large intestine? Which is, again, you saw a slide and I talked about it. What's the difference between the slide of small and large? They have the same layers, correct? But this one I said, you need for your small intestine.
Looks like the cilia, but
Not cilia, villi. Villus is one. So we give credit to the small intestine because of the villi, which is finger-like projections. We thousands of those that are coming out, equipped with arterial venule, which is mainly capillaries, as well as what's the one that assigned to absorb the lymph? Because large chain fatty acids, you cannot get them into the blood directly. And I said, you don't need to see it in the slide, but know it as theory. We call it lacteal. Remember that?
Yeah.
So lacteal, remember, for large chain fatty acid, medium and small chain fatty acids, we can get them directly, no problem. But sometimes we have large chain fatty acids. They have a complex, you see, a bonding between them. So those we have to get them through lacteals. And of course, after we get them through lacteals, we know where it's gonna drain. Intestinal trunk, if you remember, cisterna chyli, all the way to left lymphatic duct or thoracic duct, which end up where? Left subclavian vein. And join the right, of course, from the other side, and make the superior vena cava, which end up in the right side of the heart. So notice that complicated chain of fatty acid, how we get them back to the heart, then you pump them. You pump all the nutrients to the tissues after that. And that's what makes, as I said, the lymph is milky, thick fluid. Because if they ask you why the lymph is different than the blood, that's what you're gonna say. Because of the fat content that makes it thick and even slower in circulation as well. Okay. Absorption, we're done. Defecation, we said the last, elimination of waste. Waste should then stay in the large intestine, in the rectum and anal canal, because those are toxins. We have bacteria in those. You keep that waste for a good time. Bacteria can work on those. Yes, we have good bugs and bad bugs, we always say, in your intestine. The good bugs, we always want to increase the number of those. So you have a smooth digestion and you don't complain of any indigestion or any problem. And probiotics proven to help in that. For IBS, for any intestinal problems, increase your diet from probiotics. That's why people now, I remember years ago, you go and find plain yogurt on the shelf, and people just grabbing what flavor. Now look at the opposite now, because of the education about probiotics. You see that plain yogurt is running out of the shelf faster,
What
because
about
they want to
like-
avoid sugar. That's the reason.
What about probiotics like in a pill form? Do those work?
Those are still working, yeah.
Oh, yeah, they
Yeah,
work.
they work. Yeah, I'm not against those. Anything that has billions of bacteria,
Yeah, not.
healthy bacteria, you increase the number of healthy bugs in your intestine. But we have also bad bugs. So we want always to have the healthy above what the number above the bad bugs. But again, defecation is very important. All of those are toxins you want to get rid of. Very important to know the 3D layers, starting, which is same for small, same for large, not the same for stomach. Not the same for stomach, because when it comes to the stomach, I'm going to show you the difference. Stomach has 3 layers of muscle. Here, we know that it has inner circular, outer, longitudinal, and the muscularis externa layer. They're the same. We know the difference is villi. But if you look here, we can show you all the layers in the 3Ds to understand them. And I'm sure we talked about them in histology. Okay. This is the mucosa. You can see it here. And this even layer is belonging to the mucosa. See that thin muscle? That still belongs to what? To the mucosa layer. You see that one? That's, we call it muscularis mucosa. But in the mucosa, we know we have if we have villi in the small intestine, depending, but we know it has also the glands, intestinal glands, if you remember. I can see glands here, I can see glands here, and I can see glands here. Okay, 1 and 2 and 3. And of course, don't forget I said Peyer's patches. And some of you saw that in dark purple color. But here they have it to you as a green color. All of those structures that I mentioned are in the mucosa layer, which is the first layer, including the muscularis mucosa, this thin layer that you see it right now. Okay, which is this thin layer, you see it? Okay. Now, if I leave this layer, I start to see this submucosa. And it has some glands, as you see here. It has blood vessels in the submucosa. And they said that the reason it's equipped with those blood vessels, in case that you get overload of nutrients here, we can contract this muscle and send them where? To the submucosa. So it assists kind of like bringing them to the bloodstream as well, especially the fluids and things like that. But that's it for submucosa. It's a connective tissue layer rich in blood vessels. That's what it is. That's why you see it sometimes in a white color. But notice now when I jump into the third layer, which is muscularis externa, definitely I'm seeing 2 layers. And even the fibers arranged differently. So you're gonna have inner circular and outer longitudinal. You see the fibers, how they arranged here versus here? So inner circular and outer longitudinal. This is what we call it, the muscularis externa. This is the one that is important for peristaltic movement. Okay? This is the one important to move things along the lumen of a small or large intestine. Okay? Now, we need to know things here and make sure those potential for theory. The difference between submucosal plexus or Meissner plexus, which you can see it here, okay, and Airbax plexus. Meissner, you can see it here, and it's submucosal because we can see here that it's in the submucosa, and the other one is Airbax plexus. So what is the difference here? Both of them, they help the autonomic nervous system, but in different way. We know that the submucosal plexus, which is here, is important in the secretions, because you need nerve supply, of course, to supply that layer. And we see how many glands in the submucosa. And this is one, this is one, and there is a lot here. So if you're functioning your parasympathetic nervous system, we know that we need a lot of secretions, because the parasympathetic is known as rest and what? Digest. That's why they call it like this. When you're in resting mode, you're eating, you're functioning your parasympathetic nervous system. So now, we need actually to function those glands and produce more secretions, because you're eating, you're digesting. So those are important, and they have less secretions in what system? What's the opposite now? Sympathetic nervous system. That's why what they call it, what's the name for? Fight, flight. See? Fight or flight. You know, we know that this is the sympathetic, so now it creates inhibition on those submucosal glands or Meissner plexus. So inhibition versus stimulation, based on what system you're functioning. So we're done with the secretions. Now, so what's the importance of Airbax plexus? Notice Airbax is supplying what? Which layer? Just by looking at Airbax, guys, this is Airbax, supplying what? Muscularis externa, the two muscle layers. So think about it. Those gonna increase or decrease peristaltic movement, correct? So what happened if I function the rest and digest? What happened to those muscle layers? Are they gonna contract or relax?
For what?
Okay, I'm gonna repeat the question. Okay, let's start with rest and digest. Okay, what happened to those neurons, which is part of the Airbax plexus or myenteric plexus? Are they gonna increase the contraction or decrease the contraction? Increase. So peristalsis will increase in rest and digest, while in fight and flight, they're gonna decrease peristaltic movement. So remember, we need two plexuses because you're gonna talk about secretions and what? Movement. And those can be affected in either one of those systems, whether it's parasympathetic or sympathetic. That's why if you're asking me why we have two plexuses, that's the answer. Because in parasympathetic system, which is rest and digest, the submucosal plexus need to function those glands to have more secretions, okay? And the myenteric plexus should function to what? Contract the intestinal loop, which is peristaltic movement. And vice versa gonna happen in what? In fight or flight. So we know why we have two plexuses. Okay. Why we have two plexuses? Make sure if I bring you a theory question to know how to answer it. The difference between two. The last layer, we forgot the last layer, is the serosa. You can see it here. And this actually is part of the serous membranes that we talked about it. And I always tell you, don't forget the 3 Ps. All of those, they produce serous fluid, which is watery fluid, and we need. That's why if you attend, abdominal operation, the moment they open the abdomen, it looks shiny. Why? Because of this layer. This layer produces a lot of serous fluid that makes your intestine moist. We're talking about 25 feet. We want to moisten them. If you don't moisten them, what's going to happen? Dry. And dry causes what? Adhesions. Dryness causes adhesions. And adhesions cause constipation because you're not going to be able to move. You're stuck because you lost the moisture. All the moistness here is gone. So again, serosa, without serosa, you're not going to see your intestine shiny like this. And what's the other piece that we mentioned here? Peritoneum, of course, and pleura, and
pericardium.
pericardium. All of those, they produce serous fluids. And that's why it's part of serous membranes that you took back in part 1. If you remember, tissues, they talk about serous membranes. All right, so any question on the 4 layers? Yes?
Oh, it's 4, okay. Because a
4.
while ago it says 3.
3. I say 4. Mistaken.
Okay.
3 P. Peritoneum.
Oh no,
pleura.
the layers you said
Because this
mucosa,
is-
submucosa,
Oh,
muscularis,
you
and
mean
serosa.
those layers? They're 4.
Okay.
Yeah, the layers are 4. But
Okay.
the 3 Ps, all of those produce serous fluid, peritoneum, pleura, and
It's-
pericardium.
It's 4 layers because the muscular is 2 separate layers. That's why it's 4 layers?
No, we said the first muscular belonged to the mucosa. I will repeat the layers one more time. Mucosa, submucosa, muscularis externa, serosa.
Oh.
That's the 4 layers.
Yeah.
But when you want to itemize, every layer is a different thing. Okay? Now, so what it says here, you can write
3 Ps.
connected to peritoneum, just for you to understand what is peritoneum. Because peritoneum has how many layers? Every one of those having 2.
Yeah.
Visceral, parietal.
Parietal.
Yes.
Yeah. Every one of those P's, they have what? 2 layers. Visceral, parietal. Same thing here for peritoneum. So who can tell me, is this connected to visceral or parietal of peritoneum? Who can guess here?
Visceral.
Visceral, correct. The inside, of course, not the outside. Okay. And that's why I produce that fluid and fill all the gaps in between the 2 layers. Okay? So any question? Now, because of those plexuses that you saw them, the myenteric and airvax plexus, they actually, some of physiologists, they said, why not classify the digestive system on its own and call it enteric nervous system? Some physiologists, they disagree because I talked about the 2, functions. So it's kind of like some, they said, let's call it ENS and separated from what ANS, autonomic nervous system. But again, it's differences between physiologies. Yeah. I would still consider it ANS because we just talked about it and what they do, the plexuses. But some physiologists, they want their own decision, and they said, oh, it should be called, because of those plexuses, ENS, enteric nervous system. GI reflex, very important to have healthy nerves. Nerve supply to your intestine is what?
You said what?
What's the nerve supply of your intestine? The one that you studied in cranial nerves, which is the longest one that can exit the cranial the vagus nerve. It's simple. Vagus nerve is the one that increase peristaltic movements, because it's the one under parasympathetic nervous system. So increase intestinal movement. What it does to your heart, we're done with the cardiovascular. Slows it down. You see the difference? So increase peristalsis versus what? Decrease heart rate. Slow it down. We said parasympathetic. Parasympathetic rest, not excitation. So your pulse will slow down. Bradycardia. Bradycardia. Decrease pulse. Now, since we talked about the folding of peritoneum, we're gonna do mid-sagittal section. You see how they cut the body? To show you from the side. You're looking at this position now, having mid-sagittal, to show you the folds of peritoneum. And follow me how it folds, with that white line. Explain everything. So it covers the anterior surface of the liver, and of course the abdomen. You can see 2 layers. I don't know in the back if you can see 2 layers here. Yeah. And it goes actually to the inferior surface of the liver, as you see here, and then connected to the stomach. You see, that's the stomach. See how big cavity it has. This is the stomach. Now, when it connects to the stomach, and if you want anterior view, I can show you the anterior view so you can understand it. You can have it here because of the. So here is the liver. Okay. Here is the stomach. All right. So again, it covers the anterior surface as you saw it here, the inferior surface, and then connect to the lesser curvature of the stomach. And this part has a name. Who can tell me what's the name when you look at it over there from mid-sagittal section? What's the name of this?
The lesser one.
Lesser omentum. Exactly. So if I'll bring you a question. What is the name of the fold of peritoneum that connect the liver to the lesser curvature? That's, we call it lesser curvature, greater curvature. What is the name of the fold of peritoneum that connect the liver to the lesser curvature of the stomach? What's your answer? Lesser omentum, exactly. Okay, and you can see it here. And I showed it to you from front view, how it looks like. Now, it also connects the greater curvature, which we talked about it today at the beginning, greater omentum. And I showed it to you from front view, which is the yellow color in the cadaver section where we looked at the abdomen when we opened the skin and subcutaneous tissues.
But it connects the liver to the what?
No, this connects the greater curvature, so the greater omentum, and continue all the way down to the abdomen. Because it continue after that to connect with the intestine together, then the large intestine, mesentery and mesocolon. Remember, all of those are folds of peritoneum. So I think now we learned all folds of peritoneum. Let's repeat them one more time. The first one is lesser omentum. And the lesser omentum, you see it here, connect the inferior surface of the liver to the lesser curvature of the stomach. Then there is greater omentum, which you see it, of course, with the fatty tissue on top of it, connect the greater curvature of the stomach to the abdomen. And also, we talked about the loop of small intestine connected together with the mesentery, and also the large intestine connected together with mesocolon. And the good thing, I always tell the students when we dissect the fetal pig, hold the intestines, separate them with your hand to see that membrane. And what you're gonna see inside the membranes. Because you wanna ask me why we need membrane. Well, you may ask this question, why we need membrane to connect? No one asked me why we need membrane. But if I ask you this question, why you need membrane to connect those loops of intestine?
You know, during movement, they don't kink or ball up.
We know that the serosa, we talked about it, produce the serous fluid and take care of that. So they're not gonna be stuck together. We found, when you spread them, guys, I want you to see the capillaries, the arterioles and venules, and my students saw them, because what they do, they inject actually the dye in the fetal pig jugular here, and go to all branches. So spread them when we dissect and see what the tiny red and blue lines in. Because without this, we cannot bring blood supply to your intestine. You have to bring blood to your intestine. And those, we call them mesenteric vessels, blood vessels, okay? So its major role of the mesentery and mesocolon is to carry blood supply to the intestine and to take the waste. That's why you see red color and blue. Yeah. In and out, you see? And we bring them back, of course, to the liver. We talked about it, if you remember, the hepatocortical circulation, when I talked about portal vein. Make sure to look at portal vein in the liver model. It's a big vein. We call it hepatic portal vein. Next to it, the hepatic artery and bile duct. Make sure to see those guys in the porta hepatis, big opening in the liver. Okay, so what happened to in females? Because this is a female, correct? Yeah. This is a female, because here's the uterus. Now, when it goes and line up the abdomen and of course the intestine and all, it comes here to the pelvic cavity. In both males and females, it covers the superior surface of the bladder, and you guys can see that line. Now the uterus in females, it make a pouch here and cover the fundus and body, and then back to the cervix, of course, and then reflected with another pouch. You see, here's a pouch, and here's a pouch. Those are very important pouches. And they named them based on in between. So, utero, vesicle, pouch. Utero from uterus, vesicle from what? Urinary bladder. From vesicle. Okay? So, utero, vesicle, pouch, and this one rectal or utero, rectal, pouch. It makes sense how we name them, guys? Yeah. What is the importance of those pouches? Those are very important, guys, because in a trauma, in a car accident, and suppose you have a pregnant involved in that car accident, and even if she said, I'm okay, still recommended to go to the ER, because they can do ultrasound, just simple ultrasound. And here's what we found. We can find blood pooling here. That means there is bleeding from somewhere. Who knows from where, but we have to investigate. So those pouches, with the gravity, they can collect the blood down, and we can catch them by doing ultrasound to the pregnant. That's a good thing about having, because she may say, I'm okay, I don't want to go to the ER. But if she has bleeding, she may collapse. She may go take a nap, then wake up. Why? Because she said, I don't want to go to the restroom, I'm okay. Maybe small bleeding. And accumulate. First day pass, but second day collapse. Because that's gonna drop their blood pressure, goes into shock. We know that. Okay? So those pouches are very important for us. So you know those are folds of peritoneum in the uterus, anterior and posterior, as you see here. What's your question?
How do you spell that euro and the rest of the euro
Okay.
pouch?
So if you like the first one here, okay, go to the urine bladder and uterus, utero-vesicle. Pouch, just put pouch, okay? And the other one is what? Utero-rectal. All right. Okay? So we're done with the folds. Now, the last thing I want to talk about is, you can see the kidney here. Unfortunately, I want to see the kidney. You can see it. But the kidney actually is in the back. We know stomach, they put just those structures. We have the kidney, when I talk about renal system, it's retroperitoneum. It's way in the back here behind the peritoneum. That's why we use the term retroperitoneal structure. So the kidney is retroperitoneal, and his stomach is intraperitoneal structure because it's covered from both sides and start as lesser omentum and continue as greater omentum compared to the kidney, which is what? Retroperitoneal structure. So we have structure within peritoneum, we have structure what behind the peritoneum, okay? Any question on peritoneum? Okay. So make sure if I bring you a question on peritoneum and the folds, you understand how to answer it, especially lesser versus greater. Yes.
So, you know, like how sometimes in questions they like to ask about the cape-like peritoneum. Is that the mesenteric?
What's the
The
name?
cape-like, like the sheath?
That's the greater omentum.
Okay, that's the.
That's the
greater-
sheet that you
Okay.
see when you open.
Okay.
And on top of it, you're gonna see the fat tissue, plenty of fat.
I see.
So it's kind of like merged with, that's a sheet that they
I
talk
see.
about.
Okay.
So
Right?
it's fat on top of the.
On top, merged into it. Yeah. It's kind of like a protection, you
Yeah.
can say, just protection. Oh, here's what we said.
Perfect.
Yeah, perfect timing for the question. You see it? See how it looks like a sheet? Yeah. So it is protection for the fold of peritoneum, which is the greater omentum. You need to protect it. You know, this is not a fibrous tissue membrane. I talked about it's a serous. It produces serous fluid in between the two thin layers. So with that protection, it helps actually keeping it, stabilize it all the time. And that's why they put you greater omentum here. Now, if you take it out, you can start seeing, of course, all the intestine, the mesentery, mesocolon, and etc. They left the gallbladder, you see it? That's not the position of it, it's hidden. Also, you're gonna see the gallbladder when we dissect. That's a good thing. I wanna finish the theory and keep dissection until the end, so you link what you studied here, okay? And kidney also, you can dissect it as well. Oh, that's what we said, see? See the membrane, mesentery? So definition, it's a fold of peritoneum that connect what? Small intestinal lobes.
I have a question.
Yeah.
So, small intestine, we have three, right?
You have what?
Three. Small intestine is.
Small intestine is duodenum, jejunum, and
ileum.
ileum.
Yeah.
Yeah, 3 parts. The smallest is duodenum. The smallest, they said it's about 10 inches. And it goes like this. Where is the stomach? Start from here up to here, like a C, see? Like a C shape. An average 10 inches, less than a foot. This and then the second will be what, Gina, and the longest will be the area. Yeah. So this is actually the. Oh, here is another picture, guys, for greater momentum. You see how it looks like. And notice here they didn't show you the gallbladder, because I told you here they left it up for you to see it. What it says, lift it upward, you see? But here is hidden. Now we have a falciform ligament, very important ligament, guys, to know. Coronary ligaments on top of the liver. You're going to see them as lines when you study the liver. I would recommend it today. Go over it. And you can see actually two white lines on the top surface of the liver, superior, and they call them coronary ligaments. Why they call them coronary? What does the word coronary means? If you go to origin of the word coronary.
A crown?
Crown, very good. And those on top of superior surface of the liver. So we call them coronary ligaments. And there is one in the anterior, you see it? Surface, what the name? Falciform. Those are required because you're gonna see them on the model, okay? Why we need one in the front, which is falciform ligament. You see it here? Falciform ligament? Yeah. Why we need one in the front? This is one connected to what? To the anterior chest wall. Because liver is 1,000 grams, and even sometimes more depending on your body size. I would say 2.5 pounds, 2.2 pounds, depending on the size. That's heavy, correct? On top. I want to stabilize it and anchor it with falciform ligament and connect it to anterior chest wall. So that's with the what? With the falciform ligament. Otherwise, it's gonna compress on your intestine, and also it can affect your breathing and affect the peristaltic movement if it falls down. But we anchor it with this ligament called falciform ligament. Okay? So any question up to here? Mouth? So now we're gonna look at the mouth, and we talked about things, accessory like the tongue, the teeth, salivary glands, all of those accessory organs. We can see the tongue here. Definitely if you lift your tongue, you see that membrane, correct? Yeah. This is, we call it lingual frenulum, you see it? This is, prevent the tongue from going backward. Because if the tongue goes backward, it's gonna obstruct the airway. So that's protection for us to have a membrane like this, holding the tongue and prevent it from what? Going backward. Because if your tongue going backwards, it will obstruct the airway. But that's protection. Now here is one more thing. Remind me, because we saw cases like that. Sometimes this membrane is fixed with the floor of the mouth, which is here. You see, when it's fixed, it limits what? Movement. So who knows the case of children?
Yeah, I don't.
What they call it?
Name.
They have a name.
Yeah, I'm not sure.
Tongue tie.
Yeah.
Have you heard about tongue tie?
Oh, yeah.
For children, it affects their speech even.
Mm-hmm.
All of this happened because of this frenulum attached to the floor. And of course, at the beginning, we can't notice that, but when we start talking words, one word, the mom would be worried, bring him to a pediatrician, and they check, and they will tell her we need to do minor surgery here. They numb it, and then they free the tongue, make an incision here, so the tongue will be now helping in the speech process. Okay. If you like to read about it, they call it ankylglossia. All right? Ankylglossia, if you like to read about it. So with the teeth, you can see here, how many adult teeth we have?
32.
30 something, 32. So 32,
Almost like-
assuming you have your wisdom.
Wisdom.
Because some of you may not have wisdom. Not brain wisdom, teeth wisdom. So 32, correct? Okay. Now, we want to actually show you the 32 where they came from. Okay. How many incisors we have in both jaws?
8 total, I think.
Very good. 4 upper, because those are central incisors. Okay. Those are lateral. So here are 4 and 4, correct? So put here 8 incisors. Because I want to show you where the 32 came from. How many canines we have?
4.
4. So add the math now. 4 canines. Okay. How many molars we have?
8.
8. Very good. 8 molars. And how many molars?
4.
12.
Oh, 12.
Oh, yeah, three.
3 and 3. That's
4,
6 in lower
6, 9,
jaw.
12.
6 in upper jaw. 12. Do the math, and you should get 32. Okay? And which one is the wisdom? If they ask you which one is wisdom, you say third molar. Same thing. Third molar is the wisdom. The last one. Okay? So if you do the math, it's 32. How many baby's teeth?